According to Toronto Paramedic Services, every year across this country, 40,000 cardiac arrests occur outside of a hospital and 80% occur at home.
So would you know what to do if a loved one needed help? Let's discuss with a panel of spokespeople from Heart and Stroke. Patrice Lindsay is Director of Health Systems Change. Paul King underwent bypass surgery during this pandemic, and his surgery was postponed 3 times. We appreciate you making time for us on CP24 tonight as we talk about issues with paramedics and people being advised to drive themselves to the hospital right now during unprecedented times with the Omicron wave. Patrice, if we could talk about what Heart and Stroke has found so far in the stresses on our system when it comes to cardiovascular care during the pandemic, what did you identify in your survey?
Thanks very much for having us. When we surveyed health professionals, what we found is, significant stresses on health professionals being pulled away to care for COVID patients in the hospital. People with heart conditions and stroke aren't getting all the follow-up care that they normally might have gotten. There's been a lot of delays in identifying cases and diagnosing people so that the treatment that they would need is being delayed and resulting in people being worse off.
Okay, I also want to bring in Andrew Lotto joining us now, as Senior Manager of Resuscitation Operations. And Andrew, talk to us about what people need to know during these really difficult times where there isn't a lot of capacity in hospitals. Now we're learning that you might also have a hard time getting an ambulance to get there.
I think the importance is that people need to know that calling 911 and using the emergency services as they normally would is what they should be doing at this particular point in time. When there's an emergency and they need to act quickly, I think the most important thing for people is to rely on the services that had been there and stay calm and reassure people that they can help.
Yeah, but CPR is very important as well, right, Andrew?
Absolutely. So cardiac arrest is one of those things that we're concerned about at Heart and Stroke Foundation, and I think everyone needs to know that it's as simple as 1, 2, 3 to save a life. So calling 911, as I mentioned just a minute ago, using a defibrillator as soon as it's available, and pushing hard and fast on the center of the chest to the beat of staying alive is what you need to know. During these COVID times, we put the additional precaution in place of laying a cloth or a scarf or an article of clothing over the mouth and nose of the individual who you might be helping, just to prevent the spread of COVID. But ultimately, those simple actions can save a life, and people need to be able to step up just as they would during normal times. Nothing more than that.
Paul, tell us more about your story. You underwent bypass surgery during the pandemic. The surgery itself was postponed 3 times. Tell us a bit more about what you've been through.
Yeah, so that was last March, so about 10 months ago, and that was really just the beginning of the 3rd wave. So for the people that are experiencing it now, I really feel for them. It's a terrible feeling to be waiting for a scheduled surgery of any kind and really have, there's nobody you can ask when is my surgery going to be scheduled. It's just impossible for anybody to know at this point. And everybody that, it really feels like the same at that time. Everybody's listening to the news and it just seems like it's getting worse day by day. So the only thing I can say is it will pass. I mean, the surgeries did get scheduled and things did get done, but it's an awful feeling to be waiting.
Yeah, it's behind you now, Paul. It's ahead for so many people now with Omicron.
Mm-hmm.
What were some of those feelings like for you during those months when you couldn't get access to that care?
It was awful. I mean, I was kind of surprised and shocked when I got the initial diagnosis, and then you're listening to the news just like everybody is today, and it really is demoralizing to not know what the future holds. So you're kind of paralyzed, really. You're sitting on the couch, you're more or less locked in or locked down, and you're kind of hoping that the surgery is soon and not a year from now.
Patrice, how concerned are you about Omicron and what we're seeing so far based on what you've researched already?
So I think the biggest concerns are the sheer volume and how transmissible this is. Although patients aren't being as sick as they were in some of the earlier waves, the numbers of patients coming to hospital, the number of patients needing care or putting a drain on the system, so surgeries like Paul and others waiting for heart surgeries, for other interventions to prevent stroke, are being delayed. And that is going to create people having, more complications, more complex cases when it is time for them to have their treatment. And it's going to result in longer recoveries and potentially worse outcomes.
And Patrice, I wonder if you can explain to us this idea of non-emergent surgeries being pushed or postponed. I think for a lot of folks who are sitting at home watching this, they may not get that they can be really, really serious life-saving procedures.
So some procedures that at the time when the patient's put on the list is deemed that they can wait safely without being into more serious trouble. With these delays, it is important because it's not like they're not doing any surgeries. What they're doing is prioritizing. So those who have, certain cancers or heart conditions that if they were delayed even days could result in the patient being very sick or even dying, those are being prioritized to the top. There's limited staffing, as we've heard with the paramedics. The operating room staff are limited as well. So they're trying to compensate for the number of people who are sick or off on quarantine to get the most urgent cases where they're the most life-threatening done first. And those who have surgeries that, they may be in pain or living with other, problems, but they really can wait compared to somebody who needs heart surgery that may not be with us in a week if it's delayed more. So they're trying their best to prioritize and get as many people done as quickly as possible.
And when we hear about a shortage of emergency responders with 911 calls, Andrew, Heart and Stroke has videos on their website on how to learn CPR. Can you walk us through some of those steps, a little bit of news you can use for everyone at home right now to just assure them on these situations?
For sure. Well, I think our website has some really important information around how to use a defibrillator and how to do CPR and some very simple steps. And using a defibrillator and performing CPR is quite simple. And if people want to know more, they can get more training. Obviously, during the pandemic, with contact precautions, we're encouraging people to do what they can in a virtual way. So accessing those videos and learning what simple steps and actions they can take right now are really important. Ultimately, cardiac arrest happens every 15 minutes in Canada, and the vast majority of people will not survive if people don't take those immediate actions. Performing CPR, calling 911, and using a defibrillator can double someone's chance of survival, so it's really critical people recognize the signs and symptoms of a cardiac arrest and take immediate action.
And Paul, before we leave you, I just want to ask for your message to people who are watching. Many people, 2/3, that is, report having at least one medical appointment changed. You talked about all of the uncertainty that you experienced. What helped you get through it all?
Well, I mean, the medical workers are incredible people, and they're doing an incredible job. And they're like the other person said, they do prioritize, and they're doing their best to work through the backlog as they also deal with the people just showing up at their front door by ambulance. So it's the hope is that this I'm shocked that we're in a fifth wave. From my experience, but it does pass. So hopefully things will improve over the coming weeks. But in the meantime, you just got to stay positive and hold tight and wait your turn. And when you do get your turn, you got to be nice to those people working in the hospitals. They were in tough shape 10 months ago. I can't even imagine what it's like for them now.
That is a great message to end on, Paul. We're happy to see you fit and fine. Thank you all for making time for CP24 tonight. Patrice Lindsay, Andrew Lotto as well. Thank you.
Thanks.
Thank you.
Thank you.